Hello, moms. This is Kathy again with Sunny Blossom Therapy. So, today I want to talk to you about the differentiation between occupational therapy from other service provided therapies, including speech therapy, physical therapy, music therapy, art therapy, and so forth. What makes us different, and what do we bring to the table when we're servicing children with special needs? Well, occupational therapy, as you hear the word occupation, we help individuals perform their occupations, which are their roles, and whatever role is meaningful to that individual, whether that role is to perform in their career, being able to access, for example, a teacher may need support to be able to access her computer and she's having difficulty with her hands, whether her fingers are strained or she has carpal tunnel or things like that. So when we look at the individual's daily life, we ask the individual, we inquire through a profile and interviews what is meaningful to you in your daily life, in your environment, for you to be able to access and to participate in. Okay, so that is the role of an occupational therapist. When it comes to pediatric settings, we know that children participate and engage the most through play. So many of the therapeutic activities that we do when we are providing services with children is we engage with them with play. We know that they're able to find this to be very meaningful. This is where we develop relationships and bonds with the kiddos. Also, it's important that we interview and that we also build a relationship with the kiddos' caregivers, whether those are the parents, grandparents, other relatives, such as siblings. It could even be their pets. If that's meaningful to the children and if that relationship is important to the child, we might be able to incorporate their pets in our therapeutic activities. So, occupational therapy really looks at the entire individual and what is meaningful and motivating to him or her. Okay? And everything we do, okay, in the clinical base, in the medical base, we help the individual gain strength. We help the individual gain confidence. Okay, we help the individual become emotionally regulated. We help with their anatomy, such as coordination, core strength. Okay, we look at from gross motor to fine motor. So gross motor is the things that the child participates in that they are using their whole body with, their arms, their legs. And fine motor skills is all the activities that we engage in when we're using those fine skills, which is our fingers. Okay. We look at the whole anatomy and physiology. We also look at the mental state. We also look at the spiritual state. What is spiritually meaningful to that person, to that child? Is prayer meaningful to that child? Okay. We look at the culture. Okay, what kind of environment, what are some of the rituals the child participates in with their family? That's important for the child and the family. We really look at the entire being, and that's what makes this profession a little holistic and a little unique from the other professions. I can't speak exactly in specific details what the other professions do because I haven't been trained in them. But what I can say is they look at more specific things and areas. So physical therapy will look at more of being able to access their environment with their body. So doing physical, their physical strength, their coordination, things like that. Speech looks at language and communication. Okay. We kind of look at the whole person, and our whole goal when we're looking at the whole person is to help them either restore some of their skills or help prevent from regressing in those skills in areas that are meaningful to them in their daily activities. So everything that an occupational therapist does goes back to how can we help the individual access in their daily environment, and that is meaningful and purposeful to that individual. And with kids, that is typically through play. That's why you will see most of us, in the pediatric setting, play with the children. But it's not just let's have fun and play. There's a therapeutic purpose for it. There's goals that we set for the child and that we're working towards. But we do it in a way where the child is engaged and is excited to participate. That's what's so key, is that we are looking for that excitement and engagement, because then we know we're able to help that child reach its goals and be able to find this therapeutic sessions fun and exciting. That's when we know education is best grasped, right? When the child is excited in the session. I hope I covered some ground and brought some understanding to more what occupational therapy is. If you'd like to learn more how we support children in different settings, you can reach me, and I'll always respond. Thank you.